Okay. Hello, everyone, and welcome. My name is Dr. Lauren Wood from Urology Specialists, here with Courtney Applequist of MEDTRONIC. And we're going to talk a little bit tonight about therapy options for bowel and bladder problems. We may have some people kind of joining in and out, which is fine. Ultimately, this presentation will be saved and posted online, so we'll keep you in the loop about that. Thanks for joining us today. It'd be nice if we were here in person, but alas. Again, my name is Dr. Lauren Wood, and I'm out of Urology Specialists in Sioux Falls, South Dakota. It's our contact information. So more than 50% of people with incontinence have never even discussed it with their physician. And I would almost say that that number is probably higher. And so you think about things in the way incontinence infects your life, having bladder control, limiting activities. How can I possibly go on a date, attend a celebration outdoors, get a job, do normal things that you should be expected to be able to do, and your bladder can hold you back. If the bathroom is always on your mind, it's embarrassing and you're afraid to leave home, it's time for a change. And so our agenda for the evening will be to understand bowel and bladder control, get to know the care pathway available, some treatment options, and discuss the MEDTRONIC INTERSTIM and NURO systems. And then we'll have time for questions at the end. So I think one thing that's really important to understand is that if you suffer from bowel and bladder problems, you are not alone, okay? Overactive bladder, fecal incontinence, urgent incontinence are extremely common, but they're not normal, okay? So 1 in 6 adults has overactive bladder. That equates to approximately 37 million Americans. 1 in 12 adults has leakage of stool or fecal incontinence, which is about 20 million Americans. If you think of, Americans with vision problems, think how common that is. That's really only 12 million. I mean, that's a third of those who have overactive bladder versus 17 million with asthma. So you think of these conditions that are very common, and these are actually right up there, if not more common than those. So what's normal, what isn't? Well, leakage of stool and leakage of urine are not a normal part of aging. So if the following sounds familiar to you, having frequent accidents of urine or stool, getting the feeling that you have to run to the bathroom right now, planning your activities or your day around the bathroom, monitoring how much you eat or drink, granted we should all probably be doing that, or using pads or protective garments, your body is trying to tell you that there's a problem and that we have options to help you. So how does bladder control work? Well, first, the kidneys, you have 2 of them, produce urine and send it to the bladder via the ureters. Once in the bladder, when it's about half full, it stimulates nerves to the brain that signal to your brain to empty the bladder. Now, in normal physiology, you have time to get there and your bladder won't empty without your permission. That's something that you do volitionally. However, in overactive bladder, your brain is actually causing your bladder to squeeze without your permission, resulting in leakage. So it's a brain bladder disconnect most of the time. We don't know what causes it, but it is very common, as we discussed. How does bowel control work? Very similar. The intestines, digestive system push stool through and into the rectum. When that's full, it stimulates the brain to signal to the nerves to relax the anal sphincter muscle. Again, you should have control of that, and that should be on your timing. If not, then something is wrong in the pathway. So what causes incontinence? Well, a lot of times there isn't a cause, but certain habits, what you eat and drink, specifically lots of fluid intake, caffeine, if you're drinking coffee and pop, that can definitely make it worse and irritate the bladder. There are certain medications or supplements that can make it worse. If you're taking like a fluid pill, a diuretic, a lot of times that will exacerbate this problem. Reduce physical mobility. So if you physically cannot get to the bathroom in time, well, maybe you, under normal circumstances, you would be able to make it, but if you're delayed then by your physical activity, that certainly can be an issue. Pregnancy, childbirth, radiation, pelvic floor injuries or pelvic floor surgeries like hysterectomy, these are all things that can contribute to incontinence. So there are 3 common bladder control problems. One is stress incontinence. Now, this is not something we're going to focus on much tonight. That's mainly leakage with coughing, laughing, sneezing, or other activities, but there are treatments for that. So if that's something that bothers you, please reach out to us. The second is urinary retention, which is the inability to urinate, okay? Third being overactive bladder. So these are all ways in which the pathway can kind of fail. So as I mentioned, stress incontinence is leakage with coughing, laughing, sneezing, bending, exercise, lifting. A lot of women or men, it can happen to both, will kind of pee on a schedule to try to avoid that. But the reality is if you have any amount of urine in your bladder and you suffer from stress incontinence, it can trigger. What is urinary retention? Urinary retention is when your bladder is too full and you either cannot empty it or you don't realize it that it's full. Some symptoms might be pressure or a weak urinary stream or dribbling. And oftentimes this results in needing to use a Foley catheter to drain the bladder. Overactive bladder, on the other hand, is composed of urgency, frequency, waking up at night to pee, or not making it to the bathroom in time. It's the gotta go, frequently leaking, even if you've cut back on your fluids, if you need to use pads because you're leaking. We use a marker maybe going more than 8 times a day, or I say if you can't sit through a 2-hour movie, then you may suffer from overactive bladder. Fecal incontinence, on the other hand, so we talked about bladder problems, so that would be a bowel problem. And that can either happen because you can't make it to the bathroom in time and you leak stool, or you don't even feel it, and so you pass some stool without awareness. So the good news is that we have treatments that can get you back to relatively normal. And so there are many ways to treat these. It all starts with the diagnosis, visiting your either primary care doctor or urologist or gastroenterologist, colorectal surgeon if they're involved in that. We usually start with very simple modifications in lifestyle or diet. Oftentimes we'll try an oral medication, but ultimately if all of those things fail, we do have advanced therapies that are minimally invasive and very successful. So diet has a lot to do, especially with urge incontinence when it comes to fluids. Like I said, caffeine, sometimes spicy or carbonated foods can irritate the bladder. What you eat has less to do with the leakage of urine and more to do with the leakage of stool, and that varies person to person. Exercise, again, can cause that stress incontinence, but ideally exercise is not going to make you leak urine with urgency. And physical therapy can also be an option to help treat it, although that is kind of questionable. It's something you certainly can try, but at the end of the day, changing your diet, exercising, and physical therapy are usually not enough, okay? Oral medication. So we have 2 classes of drugs that can be used to treat leakage with urgency. One class of medications is older, and I really am not a big fan of them because it can cause constipation, dry mouth, high blood pressure, and worse, memory loss and dementia. And so that's not my favorite treatment. 72% of people usually stop taking the medication within 6 months, and I would say it's even sooner than that. And most of that is either due to lack of it working or side effects that are bothersome, or cost, as the newer medications, while very effective, can be really expensive. So if these conservative therapies, if you've cut back on the fluids and you've cut out the caffeine and you've tried the medication, all of that's not working for you, the great news is we do have other options available. And so for bladder control, there is tibial nerve stimulation, which is an in-office procedure. We'll talk more about that. That's available from MEDTRONIC. There's also an INTERSTIM, which is kind of like a bowel and bladder pacemaker, or there's an injection of a medication that lasts for about 6 months. And we'll kind of go through those other options. In terms of bowel control, the main option really is the INTERSTIM. There are some older surgical procedures that can be used, but wouldn't necessarily be my first recommendation. So Botox is an option for overactive bladder and urgency incontinence. And we do this here in the office. We put a little numbing jelly in the bladder and let it sit for a bit so you can get comfortable, and then inject the bladder in various locations. It is effective, but does come with some downsides. The main ones being, if you're prone to urinary tract infections, this is certainly going to make that worse. So about 1 in 5 women is going to get a bladder, or men will get a bladder infection after a Botox injection. The most bothersome side effect that patients experience, though, would be the inability to empty the bladder. We talked about urinary retention previously. It can actually cause temporary urinary retention. It always wears off, which is why you have to keep re-injecting it about every 6 months on average. But some people are unwilling or unable to accept that small risk of needing a catheter and may opt for other options. Another option is tibial nerve stimulation, or PTNM. So this is very safe, minimally invasive. It reduces those symptoms of overactive bladder and urge incontinence by stimulating the tibial nerve, which is located, you can see here on the screen, just behind the ankle. And that nerve actually communicates with the sacral nerve that ultimately controls bowel and bladder function. The way we use this treatment is in-office 30-minute sessions once a week for 12 weeks, followed by monthly sessions in perpetuity for maintenance. So this is a great option that's minimally invasive if you have the time to devote to it. And that is available at our office. And is certainly something that we can discuss further if you're interested. Finally, the third option for what we call third line therapy is sacral neuromodulation. And that's the INTERSTIM device, or the bowel and bladder pacemaker. So this gently corrects that imbalance between the nerves and the brain by stimulating the sacral nerve. And so we typically start with an in-office test phase that's testable, reversible, same day, no anesthesia. We just give you a little laughing gas to help make you comfortable, and some numbing medicine under the skin. You get a week to try it out and see if it helps you. We're looking for about a 50% or more improvement. Most people improve by more. And over 90% of patients are really satisfied with this and ultimately go on to have the permanent device implanted. So there's two options for that permanent device. One would be a rechargeable option, and that's great because you can get 15 to 20 years of battery life out of it before you have to have a new battery replaced. And a battery replacement is as simple as a same-day outpatient procedure, which is the same as when we install it as well. So when we do the test phase, going into that a little bit more, there are two temporary leads that we place under the skin, and we just float those into the foramen to stimulate that sacral nerve. You wear a belt for a week to try it out. That's what stimulates those temporary nerves, and that would simulate the ultimate device that would be put in. You have a programmer, and it looks like it's a smartphone essentially. You can change programs, go from left to right. You can turn it up and down, and it kind of feels like a tingling or a fluttering sensation. Shouldn't be painful, and you monitor your symptoms. We have you do a bladder diary before we start the test phase, and then a bladder diary during the test phase. So we can really look at those objective measures to make sure that not only are you feeling better, but that we can justify putting you through a small procedure. 89% of patients experience long-term success. I mentioned 90%. That's the percentage of patients who go on to receive the therapy, but ultimately, of those who do it, 89% are really happy for a long time. And it is significantly improving quality of life, especially for these overactive bladder, urgency incontinence, and fecal incontinence patients. If you compare it to medications, it's significantly better. So 76% of people having success for bladder control with sacral neuromodulation with INTERSTIM versus less than 50% with medications. So how do you know if this is right for you? Well, if you have significant symptoms of overactive bladder, the urgency, frequency, waking up at night, or not making it to the bathroom. If you're not able to empty your bladder, and we know that the cause is not from a mechanical obstruction like a prostate or a prior sling surgery, or if you leak stool and you've tried these simple lifestyle modifications or medications haven't been successful for you, then these would all be wonderful options. So this is Sarah. She's a patient, said, I'm getting back to doing the things that I love, and that means everything. And you know, I think a lot of primary care providers do a really great job of talking to you about your heart, your lungs, your blood pressure, your cholesterol. There's so many important things that have to be dealt with in that visit. And oftentimes both the provider and the patient, really there's just not time to discuss these quality of life issues like leakage of stool and leakage of urine. But that doesn't mean that there aren't excellent solutions and that we can't help you with that. So just to go over a few frequently asked questions. How long does the relief last? Well, it's been effective out to 5 years, but I've had patients who had their INTERSTIMs placed literally before I was born, and I've replaced their battery and they're still doing great. So I can tell you firsthand that we have really good long-term success with this treatment. Will it cure my condition? No. And that's a bummer, but nothing will. And so, you know, medications won't cure it, Botox won't cure it, INTERSTIM won't cure it, but I do have patients that are dry from it. And so you have to think about overactive bladder as a chronic illness like diabetes. You don't cure diabetes, but you manage it and you can live your life with it and you can do the things you want. And so that's how you should think of overactive bladder. What does the stimulation feel like? We talked about that a little bit, kind of a tingling or a fluttering. It's not painful. It's not sharp. There should be no shooting pains, anything like that. Most insurance companies will cover this. We really haven't had a lot of issues with that, but that's certainly, you know, something that we would find out ahead of time, so you wouldn't be stuck with any undue financial burden. And can I have an MRI? Yes, yes. This used to be that you could not have an MRI, but actually with the new technology that's come out and that's been developed, it is entirely safe to have an MRI of any part of your body with an INTERSTIM device in place. So that's fantastic news, because a lot of people who have leakage of urine and leakage of stool also have back problems or knee problems and need to get the MRI. And we don't want our treatment to preclude you from proceeding with other medical interventions that are necessary. In terms of tibial nerve stimulation, will it cure my condition? Like I said, nothing's going to cure it, but it certainly can help improve it. The stimulation is very similar to the INTERSTIM device, but you would just feel it at your heel. The reason why we do once weekly treatments for 12 weeks is because it takes a little while to kind of ramp up and gradually treat you when you do it through the tibial nerve. So we tend to see our first success probably between the 6 and 8 week mark, and then we do the maintenance to keep it up. Maintenance can be anywhere from 3 to 4 weeks, usually once a month. And it's just like those first 12 sessions, but it's, you do them spaced out a little bit more. Will insurance cover the cost? So in my experience, the tibial nerve stimulation has been a little bit more difficult to get covered, but we definitely have insurance companies and Medicare that are willing to cover that option. So it's certainly something you can explore with your provider. Okay, so I think that that's everything.
There was one, Dr. Wood, that came in.
Okay, great.
And I'll read it off the screen here. If I don't know what type of incontinence I have or what treatment will be right, what would be my next step?
So I would be happy to discuss that with you. So if you are able to come in for an appointment, we can kind of go through that. And in the meantime, just really pay attention to, you know, what am I doing when I'm leaking? Am I jumping on the trampoline, or am I sitting in the car in traffic, you know, and then in discussing that together, we can kind of help you figure out what's bothering you and how we can help treat it. Thank you for that question. Are there any other questions?
That is all that has popped on.
Okay, well, I'll give you a second, and if you think of something, you can kind of type it up. Otherwise, if any questions do arise or you want to talk further about this, please don't hesitate to reach out to us at Urology Specialists. Our office number is area code 605-336-0635, and we'll be happy to set you up with a specialist who manages these conditions. And thank you all for your time this evening. I really appreciate it. It was wonderful having the opportunity to speak with you. I wish we could have done it in person, but hopefully things calm down soon and we'll be able to do it at least in person.
Thank you, Dr. Wood. And all the attendees, those who made it and who couldn't make it, will be getting a link to the seminar along with Dr. Wood's clinic and contact information to follow, and that will be in your inbox tomorrow. Awesome.
Thank you, Courtney, and thank you all for joining. We appreciate it. Take care.
Thank you. Have a good night, everyone.
Bye-bye.